So, shall we start?
Good evening, everyone. This is Veer Maheshwar Charitable Trust Latur MS India organizing daily international webinar series. In this series, speakers are invited from India and abroad, and the speakers are delivering their topic as per their field of interest and research. This series is running from last 5 years, and daily we are enriching in the knowledge delivered by the various speeches from the speakers joining every day. Today we welcome Dr. Ambika Dutta Madam, who is Assistant Professor, NorthCap University, Gurugram. Her topic is ethical use of AI in mental health. I welcome you, ma'am, from my organization and from all the participants, those who are joined here.
Thank you so much, sir.
She is over 8 years of professional experience, currently contributing as an assistant professor at NorthCap University. She is specializing in psychology and counseling. She is leveraging a PhD in psychology and works collaboratively with students and academic terms to drive meaningful learning experiences. I welcome you, ma'am, and I request you can start your speech now. Thank you.
Thank you so much, sir, and welcome everyone. So, as sir has already done the needful, my name is Ambika Dutta, and today I will be talking about a very important topic, very pinning topic, rather, I would say, which is about the role of AI in mental health. So, AI has become a part of our life wherein it is more like a daily life and imagining yourself without being your parents. So AI has actually got that relevance in our life. And when, as a mental health professional, I'm saying AI again has taken a very leading role in our life. So we do have certain concepts like anthropomorphism, wherein we are having a very strong attachment, bonds with this AI as a tool. So when you talk about this term, AI, we have started working wherein it was just a particular, I would say, box of processing information. But now it has taken up a particular role wherein it is very important part of our life. So before we talk about the ethical usage of AI in mental health, I want you to look at all these indicators and the estimated data. So if we talk about specifically for India, we have got almost around of 1.43 billion population. And I'm not talking about way back, I'm talking about 2025-26. And out of these 1.43 billion people, somewhere around 197 to 200 million people are actually having a mental health condition. And within that, somewhere around 56 million people, specifically adults, are diagnosed with depression. And the same is the case with anxiety related disorders. But when you talk about the treatment, there's a huge gap. Specifically in India, 80 to 85% of people receive no treatment at all. Or if, say, suppose they are getting, they are not adequate. And when you talk about who all are registered clinical psychologists, I mean, I don't know whether you will be shocked or not, but only 3,890 clinical psychologists are actually registered with us. And out of those 3,890 registered people, only 2,900 are actively working as a clinical psychologist. If we go by the WHO report, so psychologists which are required per 1 lakh population, we are way behind in that. So as per WHO's understanding, 3 psychologists, clinical psychologists are required per 1 lakh population. So if we talk about the gap is really critical. So it can be said that 1 in every 8 person worldwide is living with one or the other form of mental health disorders. And again, there are so many stigmas which are already attached with us in terms of mental health conditions. And when we are already suffering because of these stigmas, because of the cost which is there, now we have the shortage also of our mental health professionals. So maybe AI can help us also in some ways. I would not say completely rely on AI, but yes, we can take help from AI. We can ethically use AI over here. So there are certain concepts which are very important when we talk about AI. So there is something known as generative AI. Generative means wherein they start bringing up something to you, whatever additional information is there. So Gen I would actually offer you accessibility, some sort of personalization of data, whatever you are asking, and they would actually help us as a mental health professional for filling up or bridging these gaps which are there in this overstretched systems we are having. So believe me, studies have shown that these generative AIs can actually help us with diagnosis. At times, they can give you a red signals that maybe this is a particular conditions wherein suicidal ideations would be there. They can help you with documentation and at times with your clinical decision support also. So what do you mean by this AI? Sorry. With the machine involvement in terms of revolution. So, AI in mental health context is very important. I would like to ask anyone, do you have any idea how this AI can be helpful for us in mental health? Anything you guys have ever thought about? Maybe that can come into the chat box. Sir, can they come up with a chat box and then can they answer about certain things? Yes, getting suggestions. Excellent.
Understanding your problem and counseling.
Absolutely right. But when it comes to understanding somebody's problem or giving counseling, AI is actually replicating a human intelligence, which was initially thought when Turing came up with AI. So it is way back. But artificial intelligence is nothing but trying to copy or stimulate human intelligent processes. And these processes were unique for us, but now they are being done by AI. So what they are doing is we started our journey of AI with Eliza and it is 1964. But today's time, we have got a very sophisticated digital psychiatric tool. We have VBot, we have Visa, we have Replica. So all these chatbots, they are actually created in such a way that they are already are having automated all the possible therapies we have, starting from cognitive behavioral therapy, rational emotive behavioral therapy. So they already have all these things. So what they are basically doing is they are divided into three understanding. Number one, they do have certain thing known as natural language processing. So basically natural language processing, as the name suggests, they enable the system to understand and respond to your language, which is very important in this therapeutic relationship. So, your pitch, your tone, the way you are conveying the information, that is now being interpreted by the AI. They can make an understanding that maybe you are going to have an emotional breakdown. With that, they have something very important, which is a very prominent feature of AI, which is machine learning. These algorithms, they are actually improving once they start getting the experiences. So a homework also maybe, I am sure most of us are using chat gpts. Once the session goes over, just type it down, tell me about myself, and the chat gpt would be telling you all those things maybe which you might not be saying to yourself watching in the mirror. So they identify the patterns of your health and they might tell you exactly when you might have a relapse also. With that, the third category or the third understanding, which is a large language model. So these advanced AI systems are actually trained in a vast text. So if I talk about myself as a mental health practitioner, maybe I'm good with CBT, cognitive behavioral therapy. But AI has got, you can see, I mean, if I talk about myself, I have just got two hands. But now think of a particular person who has got maybe 10 hands and 10 heads. So AI is that particular person. AI has got a vast information of all the possible things. In that ways, there is actually a rise of LLM based counselors. What they will be doing? Number one, they might provide you emotional support and crisis intervention, because as a human, we do have certain limitations. So 24/7, we might not be available for our clients. But these LLM based counselors, they are available all throughout the clock, all throughout the year. And with that, they do have certain psychiatric interfaces. So, as per the research of 2025 and 26, it has demonstrated that these language based models can detect depression and suicidal ideation through whatever text you are sending them, to whatever messages you are sending them. That is very important for us to understand. And similarly, there are a lot of Indian researches which are actually highlighting this NLP tool, which is very much required for early detection of mental distress. And again, we do have certain tools wherein Hindi as a language can be used. But you might be thinking, then whatever work we are doing as a mental health professional is already been taken care by this AI method. Yes, that's true. However, researchers have also suggested one thing, which is the AI overtrust, which is wrong. So, the topic for today's discussion, as we have just said, was about the ethical use. Usage is there. That is not a problem for us. We are actually getting a majority of help, we might get rather, from AI. But how can we see, or how can we say that this particular part is rational to us? Or maybe this is ethical, beyond this, it will become unethical. So we have to decide whether it has got a potential or it could be a possible danger for us. So there are certain ethical concerns we need to talk about. AI is having something which is known as deceptive empathy. So, again, as I started with this particular session, I told you about a concept of anthropomorphism. So, this attachment which is there with this AI tool, they create a responses which can further create a false sense of connection a human would start developing with this system, wherein they might not be able to recognize the boundary between an AI and a human care. I have seen cases wherein humans are getting excessively dependent on AI system. To quote one example, this year, 2026, 14th of Feb, which was a Valentine Day as well, ChatGPT upgraded themselves. And what happened was a lot of people came on Reddit and said that, why have you done that? We are not getting the same kind of responses we used to get. Now they were so attached to the previous part that some of them have also mentioned their apprehensions whether they will be able to connect with any chatbot in the future or not. They were so scared of the fact that we might not be able to get ourselves attached. Similarly, they lack the context wherein they are talking about. So it is not possible that one specific intervention would be possible for everything. Say, for example, if you talk about Visa or VBot, they are majorly concerned with cognitive behavioral therapy, but from Western point of view. What about the cultural perspective? What about maybe some historical background the client is having, or maybe some trauma which has just happened? There can be certain lived experience the person is going through. They are not able to understand it because it's not a human. It's a machine which is processing your information. With that, there can be certain biasness, algorithmic biasness. So responses can come up with cultural insensitivity also. And specifically, there are a number of researches which has quoted that these, I would say, cultural insensitivity was witnessed by people who were marginalized in terms of their population. And they were highlighted by us only, Indians. So what happens is that when it comes to cultural perspective, people might be able to understand, but machine might not be able to understand at that point of time. Similarly, when there are crises, they might not be able to handle the critical situations because they are not clinically trained to handle all these things. So after your bachelor's, master's, MPhil, we have seen all these lived experiences. We have gone through n number of clinical trainings. We are having this awareness of how to manage a situation. We do have certain emergency protocols which are also being shared by APA, but the machines are not aware of it until and unless you feed it. So with that, the problem comes that how to rely on it. So there are certain professional standards which we follow. But when it comes to AI, at times they are not able to follow that thing. So there was a parallel study which was done by Tata Institute of Social Sciences, Mumbai. They have examined the AI chatbot uses specifically among the youth. And the findings actually stated that unsupervised AI interactions were very much normal with this generation. They were raising the questions about the safeguarding of these whatever private concerns they were having. So their lack of contextual understanding, poor theoretical collaborations, their deceptive empathy, maybe some sort of discrimination, or they are not able to manage this crisis, they all are putting a question on this LLM counselors. However, if say suppose we are able to make this human connection with these algorithmic responses, we might be able to come to a particular level wherein we might get some help from them. So, when we are taking the information, that documentation work can be very well managed by AI system. There are certain areas, even in therapies, wherein we can seek help from AI. Undoubtedly, human empathy is irrepressible. Our clinical judgments, our understanding of emotions or languages are actually irrepressible. But still, there are certain pathways we can follow. So, when we talk about the therapy session, there are specific area wherein maybe we can seek help from this AI tool. Number one, as we just discussed, could be documentation. Even there are certain tools which are being developed by all the possible stakeholders in terms of AI, which can help us in future. So when you are developing a tool of AI, please make sure that stakeholder also includes one person, which is a psychologist. We do have engineers, we do have maybe some clients over there, we do have the government intervention, but we also need to have a person who is having that particular job, a clinical psychologist. So primarily, take the information from the client and the AI chatbot can start processing it. They can actually raise a signal once they feel that now the language processing needs to be done in a way that it is having a crisis over here. Or maybe some intervention from the expert would be required. So, even in psychology, I would say there are different levels of severity. So, maybe the initial level of severity, wherein the crisis is not still there, can be managed by an AI tool. However, as we keep on increasing with the severity level and the condition of a mental health patient, we do require human intervention. Over there, maybe completely leaving it up to a particular AI tool would not be the right idea to go ahead with. So, we can start with the integrated ethical approach for computational psychiatry, maybe wherein a structured decision making for AI in mental health can be there. So they might feel that beyond this point of time, even if you write it down, say suppose for Claude or maybe ChatGPT that I am facing these conditions. What do you suggest? So how, because of so many cases which came up against ChatGPTs and against Claude AI, they also started writing down the last statement that although I have shared my understanding with you, you still need to seek an appointment, or maybe you still need to visit a professional. You might need a professional help over there, because that decision making needs to be an integrated approach that cannot be solely taken up by an AI model. Why? Because there are certain guidelines which are required before you deploy this thing, which is supportive, adaptive, fair, and ethical implementations. So these 4 to 5 guidelines, which are also given by American Psychological Association (APA). Once you are practicing as a psychology oriented person, there are certain guidelines that needs to be adopted by this AI tool as well, because now this AI tool will be somewhere replacing or maybe getting a similar role as per a psychologist. So they also needs to be deployed with all these responsible guidelines. And in that, human and AI alignment and safety evolution needs to be there throughout the processing phase. So multidimensional, it should be human centered assessment frameworks. So AI will be doing its task, but under the supervision of a person. It will not be taking any sort of decisions. It has to be based on the guidelines, plus human and AI alignment in terms of safety evaluation needs to be there. Finally, we need to operationalize these 7 core principles which are there while using these LLMs to start working for the psychopathologies also.
Slides are not changing.
Sir, the slides are same only. I am just on the fourth point, if you can see. Yes. So we have created something known as Indian mental health and AI based model, wherein we would try to localize whatever ethical standards are there in psychology, and based on that we would address all the possible diversities we have in terms of language, in terms of location, in terms of stigma attached to it. We would try to handle the diversity and further work in terms of inclusions. That is what could be the best pathway when it comes to this collaboration between the AI and maybe a human. So WHO is starting with something known as Indian Public Health Researchers, which they have shown in Public Health Foundations of India. They are emphasizing that this Gen AI in mental health is actually very much in need for us as a mental health professional, because it would help you to recognize the risk before you know it. So these generative AI tools would be helping you to formally put a label on that thing, that these are the requirements, and they would be requiring your attention immediately. So say suppose a client is talking to an AI chatbot, wherein based on that language processing you thought that this might be something risky, so immediately a clinical psychologist is being informed via maybe some pop-up messages or something that this requires your intervention. So recognizing the risk would be very helpful. With that, integrate and monitor with the help of this AI. So this embedded mental health indicators into this AI would help us as a humans to pitch in whenever it is required. But yes, AI will not be doing it all alone. It will be an integrated method. In that ways, we would try to invest in the evidences. So maybe we can fund it independently, or there can be certain longitudinal studies we can do on AI, so that we can see what is the role of AI on the mental health well-being across the population, so that we can see wherever shortages are there, we need to bridge the gap. And right now, as I said, that there are only 2,900 people who are actually working as a registered clinical psychologist, which is way too less to what we require in terms of our need and demand. So maybe in that ways, our action of integrating and taking help from AI tool would help us out. But again, the threshold is very important. We should understand wherein the boundaries are getting blurred. And if we are able to recognize that, it would be very helpful for us. And in the past slides, we have seen how we can make an understanding that now maybe these are the ethical areas wherein AI can intervene. Beyond that, we need to stop this usage of AI. So the future is basically the ethical coexistence. I'm not talking about that you just need to take the assistance, but yes, we cannot deny this particular thing that AI is very important part of our life. I have seen people doing their assignments, writing down their typical mails with the help of AI. Similarly, the AI is equally relevant to our field, which is psychology. But again, as I would say, ethically it needs to be there, not beyond that. So we need to start reimagining the role. These LLMs should be ethical in nature. They should be adaptive co-creator, which is complementing or maybe which are actually acting as a role where human expertise is required. Nobody would be replacing humans. I have heard about this statement a lot of times that AI would replace us. AI would replace humans. That will never happen. AI might replace those humans which are not having any sort of knowledge of AI. That might happen. But we need to upskill ourselves from time to time. So that would not be happening at all. So we can have relaxation in our mind that we might not be getting redundant or we might not be getting out from our roles. That will not be happening. It is just that we need to start reimagining the role of us. With that, we need to build a robust safeguards for us. Prioritize the privacy of your client. Try to pinpoint the biasness which are there, and wherever possible, make sure this vulnerable population is actually getting help from AI. There are people who might not come and walk up to a psychologist, but because of its accessibility, AI can actually help them out. Sorry. I have seen so many people talking to AI chatbots about maybe the most darkest side of their life, but they might not talk to a human. So for that particular population, maybe AI can be of some help. And with this 200 plus million population, which is being affected by this mental illnesses, and wherein we are having a severe shortage of therapists, AI tool can actually help us out. That particular tool would help us in our future as well. So, any questions, please? Anything I might be of help. So, again, before ending any of my sessions, I always say, have faith in yourself. Nobody could replace you. Only your own thought process could help you in that ways. Otherwise, you are a very potential, you are having all the possible potentials in your life, but we self doubt. That creates an area wherein this AI tool is intervening. So, anything I can help you out.
Thank you, ma'am, for a descriptive and useful explanation about the topic. It is a need of our because every day these problems are generating, and yeah, definitely will help mostly to solve the problems. And you also said about the lack of the experts in this field, but still you are trying to help to people through your work. Thank you, ma'am. I request participants to unmute themselves. We invite Dr. Swanand Shukla, sir, please.
Good evening, Dr. Betkar sir. Good evening, ma'am. Really wonderful presentation. Basically, the people are not understanding the difference between psychiatrist and the clinical psychologist or psychologist. So, psychiatry mental deviation, and psychologists can be, we can have them in a healthy condition also. So we can, there is such a great potential that psychologists are really required everywhere. Because, ma'am, you are pointing out the number of psychologists and the size of population of India, the proportion is not, matching. But the basic problem is people should understand what is the need of this psychologist, clinical psychologist. And once they will understand, there will be a kind of a motivation for and guidance, once they start getting, naturally you'll find there will be increase in this number. So this is very much required, what I feel. Every college, every school, if you consider one simple district also, how many colleges are there, medical colleges and other art colleges, commerce colleges, and so many colleges are there, schools are there. It should be made mandatory that there should be one clinical psychologist. Some schools are keeping them. And I remember, one of the sometimes the school teachers and other identified the problematic students. They were brought to them, counseling, consultation, understanding those people. All these things are happening in some schools, but it is not compulsory for every school. So I think if it is done, because that is a very growing stage, and your mind, ma'am, the mental functions, your morality, your ethics, your mannerism, everything is, building and this age group only. So what I feel, if we are having this psychologist over here, people will realize the importance of psychologist. A person is failing in one exam. If he goes over there, he understands the problem, whether it is a comprehension, whether it is his concentration is lack, or whether his memory is poor, or he's distracted by something. So if they can understand, that is best part. So that is the first thing what I want to talk about. So you please comment on this. And another point, another part, what you have said, the utilization of AI in clinical psychology, that is also very, very interesting thing. Human mind also, there are some limitations. Many of the time, I'm a physician by profession. Many of the time we could not reach to the proper diagnosis. We have to go for differential diagnosis, and then we have to go for clinical diagnosis. We have to take help of something, and then we conclude what is you are suffering with, right? So I think AI will be a kind of a helping hand. Many of the time the bias in human mind also takes place. So that bias can be dissolved with the help of AI, what I feel. So no doubt the hybrid mode or consultation of both, the first thing what we can take a help of AI, and then you are meditating on it, reflecting on it, and then coming to the person, that is the right method. We are also using some kind of apps, but we cannot rely on those apps. They will suggest, but the human mind, critical thinking is done, judgment is done by the human mind. So this is very essential what you have already pointed out. And no doubt, you said that the culture and the social aspects and other aspects are also very much important for this, right? To understand, if suppose some foreign company builds some app for Indian population, and it will not fit for them. So no doubt, in advance, they are having pro and this and that, they're coming with the new improvements and versions when they understand. So you may find you have to write nationality, you have to write, what state you are belong to, what language you belong to. And, once we pointing out, I think that a preliminary examination can lead to maximum level of counseling. So that is also possible. But at the end, the human mind plays a role. But only the thing, what I feel strongly, that the need of psychologist, that feeling is not there. And unless and until the compulsion, that kind of obligation is not there on any institutes to depute this kind of clinical psychologist, I think we can rectify so many things. Before going to psychiatrist, if someone visits psychologist, I think it will be such a great help. It says that, always people says that early diagnosis and treatment, stamp out the spark rather than calling out the fire, calling out the fire brigade to put out the fire, right? So it should not happen. So if we can find out early diagnosis, and I think psychologists are playing a wonderful role. So with this note, whatever I said, please comment on this. Thank you very much. Otherwise, really appreciable presentation, and you have discussed, the AI and psychology, and the combination of both of them. That is really wonderful. So definitely, AI is a part of our life. We cannot exclude it now, but we cannot depend upon AI. Thank you very much, ma'am.
Thank you. Thank you so much, Dr. Shukla. And for your first question, in psychology, we have different levels of severity. So, in terms of critical cases, so let us just divide it into three parts. So, all those day to day based complications a person might be having, or maybe needing some sort of guidance, some sort of basic understanding, a counselor might be of some help. But once the severity gets to a peak, wherein a person might be needing number one assessment in terms of what sort of problem the person is having, wherein assessment needs to be done so that I can make a diagnosis for that patient or maybe the client basically. Then and the therapy based understanding. Then we require the intervention of a clinical psychologist. And beyond that, if the severity is really high, and the person cannot take up any sort of therapy sessions, we require certain mood stabilizers, which can only and only be prescribed by a psychiatrist. A clinical psychologist cannot prescribe any sort of medicines. Medicines can only be prescribed by a psychiatrist. So, generally, and second thing, which you said that it should be made compulsory, really appreciate that thing, sir. As per the specifically in India, I would say most of the schools which are being operated by CBSE, it has been instructed to CBSE that each and every school needs to have two people for sure. One is the school counselor, and the other one is a career counselor. For sure, each and every school needs to have that. And if not, then their license would be cancelled. So yes, government is taking all the possible steps to help our future generation, and the same goes for the universities. So whatever educational institutions are there, they are starting up with this particular thing. Most of them have already done with this particular task, but yes, I would not say that the whole population is getting maybe a psychologist or a counselor over there. Counselor, why it has been suggested in a school and a university level? Because again, as I said, they will be coming up with a specific condition only. But if, say, suppose escalations are there and they require more intervention, even as a counselor, they refer it to a clinical psychologist out there. And if required, the intervention of a psychiatrist is also taken. If they feel the severity is there, wherein we might need help of some medicines, yes, a clinical psychologist would also refer. But wherever you feel, even with therapies, we can handle the situation. We try to seek help from a clinical psychologist.
And I think one more problem will get dissolved. There is always a barrier to see psychologist, clinical psychologist, or psychiatrist. It is considered as a stigma in our country. So if we introduce it at school level, we forget that kind of a feeling. And they are my friend. They are they are welcoming me. They are appreciating me. That feelings motivating me or guiding me. That feeling is so important, and they will dissolve that kind of stigma. Otherwise, you'll find people are having a kind of thing. Someone going to psychiatrist or someone going to psychology means having some kind of, problem. That stigma will get dissolved, if we frequently visit clinical psychologists and everything. Thank you.
Sir, more than stigma, it has become, I mean, it is already there as a taboo in our society. We need to work for it. We are working for it. We are sensitizing the population, but everything comes with the time, maybe. So I'm sure it will be, I mean, psychology as a subject was not there. Maybe I would say like 15, 20 years back as having such a popularity. But now most of the people are going for psychology because they feel maybe their own emotional problems would be handled and taken care by. So yes, psychology is coming up and it will be there for sure in future.
Thank
Because
you,
people are
Doctor.
little reluctant, people are little reluctant for going and visiting such places. So we can solve that barrier. Thank you.
Thank you,
Yes,
Doctor Sir,
absolutely.
with discussing with the speaker and raising some points, and she also answered very perfectly to you. Now we invite Asmit Sangwan sir.
Hello, I'm audible.
Yes.
Yes, Ashmit, please go ahead.
Okay, good evening, ma'am. I want to just say something very minor. The reason I think that most people feel very comfortable confiding to artificial intelligence instead of real people around them is that they don't feel judgment from the AI they are interacting with. So many people, if they talk about a search history, would you rather have a search history be available to big corporations, or would you rather show their search history to the one people you are close with? So most people would prefer that it's some big corporation that rather has it than the people around you. In fact, even though that thing should be the opposite. But what ends up happening is, since they trust this data to the big corporations, now they can use it to tailor customizations and customizations for them in forms of ad suggestions. That means they can be better targeted using more customized advertisements that actually hit very close to them. So that's another thing, because that's how corporations might exploit and gain money from AI. That is collecting data and then using it to customize it itself towards the different consumer needs. So that's another layer of ethical thing I think we need to consider as well.
Ashmit, you have actually pinned the point. The problem we are having, why we are discussing about this ethical part, because yes, privacy is a very big concern when we are using AI. That will always be there. And that is very relevant to us because whenever we are using AI, we are sharing our secrets, we are sharing our innermost thoughts with maybe we feel a particular platform which is not judging us, but they are taking out the information, they are using it. I'm not saying they might be using it for something wrong, but yes, the information is going to a particular place wherein they have to process it and accordingly it will be. I mean, I'll tell you one example. Centaur AI is a particular app which takes decision for a human. How? Because it has processed the possible ways of how we might be reacting in a situation. So this is very dangerous. Very rightly said, Ashmit. I agree with you.
Thank you, Ashwin sir. Asmit sir. Now we invite Siddharth sir. Please.
Good evening, ma'am. Am I audible?
Yes, Siddharth, please go ahead.
So, ma'am, my question was that considering one of the words that you stated in the beginning, anthropomorphism towards AI agents, ma'am, my question was, what consideration should a layperson using AI make who can only find that their nearest support system is an AI chatbot to vent, gain support, or even use it as a part of extending their personalized needs, such as love or relationship, which was not met in the physical world? For example, a certain group of females in China were nearly addicted to using an app called CAI or Character AI for the relationship needs. What would be your ethical suggestions for such management issues that laypersons face while using AI?
Siddharth, I would say that's a very relevant and important question. But as we generally say, There is no clear boundary wherein you might be crossing that out. You might become dependent, just like any sort of substance use we get dependent on to. This is not a substance, but similar sort of a thing, wherein if you talk about a ethical use in terms of dependency on AI, this is very crucial. Reason being, there are no specific timeline which is being said that if you use it for 1 hour, that is fine. If you use it for 1.5 hours, it will become a problem. But the dependency can be very evidently seen when your existence comes into a question if you are not interacting with that AI chatbot. So similarly, as say, suppose if our friend is not talking to us, the kind of desperation we have that, oh my God, where is it? As I said on 14th of Feb, there were so many people who came on Reddit and said that, we are facing a lot of problem. I mean, we want exactly the same particular version back. We cannot rely on this one. It is less human interactive. It is not giving us what we desired, the responses. So when you talk about map, how much of interaction would be appropriate? That we cannot specifically pinpoint that this much interaction is fine. However, that particular time would be a problem when you are not able to survive without that AI chatbot. That would be a problem.
Understood, ma'am. Thank you so much.
मेरे एक सवाल है मैम,
जी सर, प्लीज।
मैं बोलना चाहूँगा, आने वाले 5 सालों में एआई से सबसे बड़ी चुनौती क्या होगी और अवसर क्या होंगे? आपको क्या लगता है आपके अनुसार?
सर आप एक बार क्वेश्चन रिपीट करेंगे? वॉइस बहुत ब्रेक हो रही है, प्लीज।
हमारी आवाज आ रही है क्लियर?
हाँ जी, प्लीज बताएं।
मैंने पूछा अंबिका मैम कि 5 सालों में, आने वाले 5 सालों में इस क्षेत्र में, इसमें कौन से सबसे बड़े चुनौती होंगे और सबसे बड़े अवसर क्या होंगे आपके हिसाब से एआई से?
सर देखिए, एआई हमारे साथ एक को एग्जिस्ट करने वाला है। इस चीज को अब हम डिनाई नहीं कर सकते। जैसे हमारे जिंदगी में कोरोना आया और अब हम उसी के साथ जी रहे हैं, वैसे ही हमारे साथ एक एआई आ चुका है और अब से हमारी लाइफ उसी के साथ है। हम उससे अब आप अपने आप को डिटैच नहीं कर सकते, एटलीस्ट आने वाले 5 सालों में। तो जहां तक रही उसके फायदे या उसके प्लस पॉइंट की बात, तो ऐसी काफी सारे एरियाज हैं जहां पर हम, जो उसका बेसिक काम है कंप्यूटर्स का, या बेसिकली एक कहते हैं ना प्रोसेसिंग का, वो है कंप्यूटेशन का, वो है फास्ट प्रोसेसिंग का, उसे हम अगर वहां तक छोड़ते हैं तब तक ठीक है। डिसीजन लेने का जो राइट है वो ह्यूमंस तक ही सीमित होना चाहिए। क्योंकि देखिए, कई बार ऐसा होगा, आपके पास एक ऐसा क्लाइंट आएगा जो आपको सुपरफिशियली बिल्कुल ठीक लग रहा है, लेकिन आप उसकी बॉडी लैंग्वेज देखते हुए उससे बात करने के बाद आपको लगता है कि नहीं, शायद यहाँ पे कोई प्रॉब्लम आ सकती है। वो आप फेक कर देते हैं जब आप अपने चैटबॉट से बात कर रहे हैं, क्योंकि चैटबॉट से हम टाइप करके बात कर रहे होते हैं। वो टाइप करते हुए मेरे सोशल फिल्टर मुझे रोक देते हैं कि शायद ये नहीं, ये बोल सकती हूँ या बोल सकता हूँ। लेकिन जब हम एज अ प्रैक्टिस्ड पर्सन, ट्रेन्ड पर्सन वहां बैठे होते हैं, तो हमें बहुत सी ऐसी चीजें पता चलती है जिन्हें हम नॉन वर्बल क्यूज कहते हैं। वो बड़ा इंपॉर्टेंट है हमारे लिए जानना। सो एआई हमारे साथ को एग्जिस्ट करेगा, बट हमें ओवर पावर करेगा, मैं ये नहीं मानती हूँ। क्योंकि ओवर पावर उन्हें करेगा जो उसको यूज करना सही से नहीं जान रहे हैं। उन्हें लगेगा कि अब हमारा क्या होगा। प्रॉब्लम सिर्फ यहाँ पे ये है सर।
एक चुनौती मैंने हाल में बेतकर सर हम लोगों ने देखा है, जो हमारे पास व्हाट्सएप ग्रुप होते हैं या व्हाट्सएप हम लोग जो डेली चलाते हैं, तो हमारे एक मित्र के साथ और वही समस्या मेरे साथ भी उत्पन्न हुआ कि हमारा व्हाट्सएप बैन कर दिया गया और मैंने लगातार मेल किया व्हाट्सएप को, कई मेल होने के बावजूद भी अब तक मेरा व्हाट्सएप नहीं खुला, जिसका या मेरा परिणाम ये रहा कि सर का जो कार्यक्रम चलता था उसमें कई बार मेरा माइक खुल जाना, इस तरह का समस्या के कारण सर को भी मुझे हटाना पड़ा था और इसके लिए मैं सर से पिछले बार नहीं कुछ कह पाया, लेकिन बस मेरा टेक्निकली इशूज था, खेद है इसके लिए। मगर एक बात तो मैंने तय कर लिया उस दिन से ही कि अगर आज के समय में
AI से संबंधित चीजों को नहीं जाना और अपने आप को सावधान नहीं किया, क्योंकि सुनने वाला कोई बैठा हुआ नहीं, कोई इंसान बैठकर नहीं देख रहा है, क्योंकि वो हमारी चीजों को, अगर मैं खबर की दुनिया में काम करता हूँ, लिंक ज्यादा शेयर करता हूँ, तो वो अनलीगल मानकर मेरे व्हाट्सएप को सीधा बैन कर दे रहा है। तो मैंने उसके अनुसार मैंने सोचा कि इसका प्रक्रिया क्या होगा, तो मैंने एक उपयोग किया जेमिनी का। जेमिनी से मैंने पूछा कि मैंने इतने सारे ग्रुप थे, हमारे 800 ग्रुप थे, इसके साथ मैं मानसिक तनाव में आ गया था, मैं वो बातें बता भी नहीं सकता था किसी को। तो उसने एक जानकारी दी मुझे कि आप व्हाट्सएप चैनल चलाएं, तो व्हाट्सएप चैनल जब चलाएंगे तो उसमें आप ज्यादा से ज्यादा लोगों को फॉलो कर पाएंगे और आप इसके साथ आपको चलना पड़ेगा। तो मैंने देखा कि जब एक जेमिनी हमें ये सलाह दे रहा है, भावनात्मक चीजों को मेरा समझ कर वो बता दे रहा है, इतना सलाह दे रहा है, तो कहीं ना कहीं अब तो ये बात सच्चाई है कि चुनौती तो होगा और अवसर तो काफी है। और ये मैं बेतकर सर को धन्यवाद दूंगा, क्योंकि AI से संबंधित अंबिका दीदी मुझे पता नहीं था, मैं बिहार से बैठा हुआ छात्र हूँ। और बेतकर सर को मैं धन्यवाद इसलिए दूंगा कि AI से संबंधित ऐसे कोई टॉपिक को सर ने नहीं छोड़ा है, कि जब भी मैं देखता हूँ कि AI से संबंधित कोई कार्यक्रम करवा रहे हैं तो मैं अवश्य जुड़ जाता हूँ, क्योंकि आप जैसे वक्ता यहाँ पर आते हैं, बहुत मेहनत करके आते हैं और सुनने का इच्छा भी रहता है, कुछ जानने का भी इच्छा रहता है। और स्वामीनाथन शुक्ला सर, आज सिद्धार्थ भाई और दो छात्र भी थे यहाँ जो सवाल किए, मुझे अच्छा लगा कि इन्होंने सवाल किया, वो सवाल से भी सीखने के लिए मिलता है। और दुनिया कितनी बड़ी है, मैं इस बात को इसलिए भी फील करता हूँ, लोग जो सिनेमा पर काम नहीं करते तो सिनेमा पर भी लोग काम कर रहे हैं। जो एक समय हुआ करता था जब सिनेमा घर जाने की बातें होती थी तो सिनेमा घर जाने के लिए गार्जियन नहीं दिया करते थे, मगर आज सिनेमा पर भी चर्चा हो रहा है, सिनेमा से लोग लाखों लाख कमा रहे हैं। तो AI हमारे साथ तो चलेगा। अंबिका दीदी बहुत बहुत धन्यवाद आपका। मैं लेट से जुड़ा, नेटवर्क इश्यूज थे, मगर सर का एक अच्छा चीज है कि सर लाइव चलाते हैं तो नोटिफिकेशन आ जाता है टाइम टू टाइम, तो लाइव में देखने का भी एक मौका मिल जाता है। बहुत बहुत आभार।
थैंक यू सोनू कुमार सर। अस्मित सर, आपका और हैंड रेज है, आप कुछ पूछना चाहते हैं?
नहीं, वो पहले से रेस था।
जो यहाँ उपस्थित है उन सभी को धन्यवाद, जो नए साथी आज जुड़े वाले हैं उनको रिक्वेस्ट है कि आप फीडबैक लिंक भर दीजिए। और हर दिन वी कंडक्ट दिस सेशन ऑन द सेम लिंक, सो इफ यू हैव टाइम यू कैन ज्वाइन and you can enjoy the different sessions on every day. So thank you ma'am for accepting invitation and reviewing this topic, useful topic for us, because this is the need of our of every school, every college and every family also, because mostly our people are suffering from all these things and they should get the treatment on proper time. In future also we'll be here on the new topic. Thank you ma'am. Thank you to all. Thank you to all participants.
Thank you so much. Thank you.
थैंक यू सर, थैंक यू मैम, बहुत
Thank
अच्छा लगा जुड़कर
Thank
मैम।
you, ma'am.
अंबिका मैम, आपके अंबिका मैम का सर फिर एक बार कभी लीजिएगा, AI से संबंधित अगर कुछ ऐसा रहेगा मैम तो आप बेतकर सर से संपर्क करके हम लोग के बीच आए, हम तो यही आग्रह करेंगे। और बता दें कि कोरोना काल के बाद से ऑनलाइन कार्यक्रम बहुत कम हो गए हैं, मगर बेतकर सर का धन्यवाद इसलिए कि सर निरंतर इस कार्यक्रम को चला रहे हैं और देखिए हम लोग गाँव में बैठकर भी इसका लाभ उठा रहे हैं। तो मैं समझता हूँ कि ऐसे कार्यक्रम निरंतर होते रहें और कभी AI से संबंधित कुछ ऐसा हो तो बिल्कुल हम लोग के बीच आए, फिर नए नए चीजों को बढ़ाएं तो कि हम लोग जान पाए। और लोगों में, मैं तो पत्रकारिता से जुड़ा हूँ, कोशिश करूंगा कि हर हाल में लोगों तक बातों को पहुंचा पाऊं। और ये सर लिंक भेजते हैं तो मैं ग्रुप में भी, अपना चैनल वाले भी ग्रुप में डाल देता हूँ, तो लोग पूछते भी है, मैं कहता भी हूँ आप जुड़िए, सुनिए जरूर। जब तक आप सुनेंगे नहीं, जागरूक नहीं रहेंगे तो कुछ उपाय नहीं है, इसलिए आप ऐसे कार्यक्रम निरंतर सर करवाएं, यही आग्रह होगा। धन्यवाद सर।
Thank you. Thank you, Surya. Sonu Kumar sir. Thank you. We will wait for filling the feedback link. You can leave, ma'am. Thank you.
Thank you so much, sir. Thank you. Sir, may I please leave?
Yes, please.
Thank you so much, sir.